All right, thanks everyone for joining us. Welcome to this first episode of the Clear Health Pore Decisions podcast. My name is Michael. Our first guest is none other than Dr. Aaron Farberg, our very own medical director. In this podcast, we'll be touching on topics from telehealth to acne to new developments in dermatology and everything in between. So without further ado, please give me a warm welcome to Dr. Aaron Farberg from Texas.
All right. Now, I think there should be some clapping in the background, right?
Clapping.
Good. Okay. Not too much. Hey, no, thank you, Michael. Again, it's always a pleasure to just be hanging out with you and chatting about all things acne. As a board-certified dermatologist, I see a lot of patients with acne. So this is kind of a topic of great interest. And how many episodes are we doing? Like 40, 50? Because there's so much to talk about here. I'm excited. Let's get going.
Yeah, let's do 100.
200. Okay, 200.
Deal. Starting off, would love to just dive into your background. How'd you get into dermatology in the first place? How'd you become a dermatologist?
Of course. Well, so it actually, I did medical school at the University of Michigan. So go blue, but that's okay. I have nothing against Ohio. I actually married. My wife is from Ohio. And then from there, actually, I did plastic surgery first at the University of Michigan. After 3 years of doing plastics and reconstructive surgery, I was really much more interested in the skin cancer aspect of things. And so I then did a year fellowship in New York City on skin cancer, followed by a residency in dermatology, followed by another fellowship in Mohs surgery. So like I told my wife, I was just trying to avoid a job for many, many years, and I successfully did it. But again, I was very excited by dermatology before I then ended up where I practice now in Dallas, Texas. What's unique about my practice is that, I have 9 offices open currently, but what I'm really most proud of is we also have a dermatology residency program, a fully accredited program where we have 3 residents a year, and we'll probably be increasing that. The joy of dermatology is that you treat over 3,000 diseases. And yes, acne is just one of those 3,000. But as a dermatologist, you have to be good at everything, not just skin cancer. To be good at inflammatory disease, psoriasis, atopic derm, and the bread and butter acne. But guess what? Acne isn't always just bread and butter and easy cases. There's a lot of complications. There's a lot of issues. There's a lot of just really titrating and finding the right therapies with acne. And anyone can quote do it, but only a board-certified dermatologist can really do it at that very high level that's personalized and right for every patient. So that's my background. That's how I got here, and excited to talk about all the poor decisions we can make together.
For sure. So since 2020, we've seen with COVID kind of the rise of telehealth. In the context of dermatology, how do you kind of view telehealth and doing it properly, safely, making sure that patients are getting the best level of care?
Gosh, yeah, COVID really did teach us a lot, both good and bad. And it also essentially forced us into a new phase of life, and that's telemedicine. For a lot of doctors, we were very avoidant of telehealth. And the reasons behind that is, there's just logistics, seeing the patient. I can just tell you, particularly when telehealth really sort of started to launch with COVID, I would say half of my patients, it was videos of ceiling fans that I was seeing, not actually of the patient, because that's just how everyone was positioning their camera. But telehealth has really taken off, and it's been an important adjunct to our practice, and I think majority of my friends' practices. And that's just not even dermatology; it's across the board, other specialties. Dermatology, of course, lends itself in a very particular way to telehealth or teledermatology. We're a very visual field. We're often looking at rashes, moles, acne, what have you, in order to make a diagnosis, and then we're able to treat. And it's that simple in the sense that this can be performed in a virtual way, and it's not that it's not complex, because actually I'll often get for telemedicine, hey, take a look at this mole. And unfortunately, I have to tell the patient, virtually, look, this, you need to come in. I need to actually really look at that mole closely. I need to feel it. I need to use dermoscopy, which of course they don't really have at home. So, it's interesting that some things you might think, lend themselves to telemedicine and other things don't. And acne has been one of those particular disease states where that it works perfectly for telemedicine. And many of my patients, I'll see them live first. Then I'll say, hey, do you want to make this more convenient? Maybe you're going away to college, you have school. Let's improve the convenience for both you and our office, and let's do some telemedicine. Particular to our platform, though, is with the digital age, it really allows us to up the level of care that we're providing. Oftentimes in a dermatologist's office, we have to be quick. We only have so much time for every patient. Lots of staff are going in 20 other directions, for all the other patients that we're dealing with. Telehealth allows us to actually kind of slow that down, pay sometimes even closer attention, and then also offer even higher levels of care. I know we'll talk about that a little bit later, but the nurse psychiatry line that we have as well is very important to give that overall comprehensive care for the patient.
Gotcha. I'm curious too. I don't think I ever asked you this. Going into dermatology, did you ever have experience with acne yourself?
Well, like every teenage guy, I don't want to admit it, but yes, of course. We've all been through that awkward stage of hormones where, okay, you've got some pimples. What do? I have an older sister. I would sneak into the bathroom and kind of see what sort of like products she had. You'd use like some salicylic acid washes. I actually did eventually see a dermatologist when I was in college, and it wasn't a very great experience, to be honest. It was a very quick visit. I'm sure they actually spent more time, but there's so much information that how much did I really retain? All I retained was that I got this prescription for adapalene. It was prescription at that time, and I tried it. I got red and flaky, and I threw it away, and I said, well, that didn't work, and so I was back to square one again. As a teenager, of course, we want to look our best. I feel bad for, my 4 kids that are going to be growing up into this world of, bullying and trying to look good and image and Instagram and all the, the Snapchat filters. See how cool I sound even saying these things, right? They're probably old already. But in any case, I did have acne, and it wasn't easy going through it.
What eventually helped?
So it was unfortunately a lot of trial and error. I mean, I was literally trying a variety of different products. And of course, as my lifestyle and social life changed, so did the products that I had to use. I mean, particularly when I was younger, couldn't really just go out to the store and didn't have all the money where I could just buy a bunch of products and try a variety of different things. So I was kind of stuck with what was at our house, what my sister had. And, again, I was kind of ashamed to even ask about it. But then as I got a little bit older, got into college, had a little bit more freedom, could really trial and error some more of these products. So isn't that a bummer? It's trial and error. I mean, that's not what we should be doing nowadays.
Yeah, and that was the same experience with me for over 10 years.
Look, I love your story too. I hope you if you haven't shared it yet on this podcast, you got to share your story too, because when you first came to me with this idea, I know, a lot of people were like, no, I'm not going to do this. This is silly. Not the right way. But yeah, I was taken back by your story.
Well, for me, it was Accutane was the only thing that actually kind of really treated the acne after going through 5 different dermatologists before hitting the one who actually put me on Accutane. Tried everything from topicals, oral antibiotics. I went on a vegan diet for about a month. That didn't last that long. That was pretty bad. Didn't help. Low glycemic diet too. That didn't help. Like meditation, kind of de-stressing, kind of everything. But the only thing was Accutane. And I think anybody who kind of goes on Accutane, they hear about it. There's a little bit of a stigma surrounding it. Is it dangerous? Is it not? There's this whole process of iPledge that you have to go through. There's all these considerations. So even when I went on it, there was kind of all these things considering before kind of going on the drug. And then obviously once you're on it, it's the hassle of going in person every single month, back to the office, doing these blood tests. If you're female, you got to do these pregnancy tests. And that was where the idea came. It was, this seems so tedious in person. It seems so unnecessary for lack of a better term. Especially if, you're a female patient, you got to do these monthly pregnancy tests. If you miss it, you got these windows. And so the idea for Clear Health really stemmed from, can we actually make this easier for patients? And then in turn, also make this for clinicians as well by taking all this administrative work off their table.
And you even did it the right way. This is something that, I give talks on and get asked about, when it comes to acne, what are some of the other treatments that you can do? And of course, everyone talks about, prescription stuff, but hey, what about just simply lifestyle changes? Stress plays a huge part in this. Sleep. I know, living in New York City, you tout it as the city that never sleeps, right? Well, guess what? You're also the city of pimples then. You need to de-stress and you need to drink water. You need to actually eat healthy food. That's fruits and vegetables. All those things are not easy. And you did them all. And the point is that you still then struggled. And it really disappoints me to hear that you struggled through 5 different dermatologists to get to what was really the right treatment for you. And this is something that, I won't stand up on a soapbox and lecture too much, but it really is precision medicine. It's getting the right treatment for the right patient early on. And I mean, this is an issue we're all dealing with. Insurance companies, they have this thing called step therapy, and many states have essentially created laws to stop it. It's insurance companies forcing you to try many of these treatments that don't work all that well. But what's crazy is that in medical school, we're taught about the, quote, therapeutic ladder. And that's what you went through. You went through a whole bunch of other therapies on a ladder form that just didn't work because, well, they were cheaper, they were easier. And the thing that I don't understand is, like, why were we indoctrinated in that way in medical school that, wow, we should make our patients jump through all these hoops? It just is silly when really the appropriate treatment, if I'd seen you in my office now, I would have said, yeah, you need Accutane. We don't need to go through months or years, in your case, of not getting the right treatment. That's miserable. So, that's I'll get off the soapbox now, but that's my lecture to all my fellow colleagues of get patients on the right treatment earlier. And Accutane is definitely one of the great options for treatment of acne.
Well, I think it's not just the step box that you're talking about for the insurance side, but it's also, the first time I went to a dermatologist, they looked at my acne and they said, this isn't even bad. And it's the whole psychosocial aspect. It's, for some people, having a couple pimples can be a big deal. For some folks, having severe acne, they don't really feel that bad about it, but it's such a personal issue, and we see that so much with our patients. And I think that kind of played into why it took so long for me to get on Accutane as well.
It's a big problem across so many disease states. How do you gauge severity? Mild, moderate, severe acne. Really? We're counting pimples? The reality is everyone's perspective might be a little different. We do the same thing with psoriasis. We look at how much of your body surface area is involved. Well, guess what? If it's on your scalp and it's flaking and then you can't go out because you feel like you have flaky scalp everywhere, that's pretty impactful, even though it's a small body surface area. Acne, I see that all the time. A few pimples can be very distressing for a lot of patients. And yeah, in those cases, we need to have a very serious approach to their therapy.
For Accutane particularly, as we talked about years ago when Clear Health started, that was our entry point into telemedicine dermatology. What are some of the advantages that you kind of see with doing something as complex as Accutane via telemedicine versus kind of having to go into the office every single month?
I liken it to the digitization of even our medical records. And yes, I know all the other doctors listening to this, I know you're going to say, well, gosh, the EMR, electronic medical record systems, has been a huge pain. And they have. But imagine if you could develop an EMR that actually was more functional around us. And that's exactly what we did at Clear Health. It took basically a year of programming. And no, this is not circumventing iPledge. This is not cutting corners or cheating. This is actually taking that very difficult system, as you mentioned, this very onerous system, and saying, how can we make this in a more efficient and actually, I would say, improved overall manner? You got to get labs. There's a window where you get the labs and then you have to pick up the prescription. Right now, how most offices are doing that is their order forms, The patient goes off, maybe gets their labs. Where did they get their labs? Maybe it's at the big, testing center. They went to the wrong place. Their insurance wants them to go somewhere else. Who knows what? Okay, now they got their labs. Great. You have 1 week to pick it up. Okay, well, when did the doctor send in the prescription? And do those all line up? And oh my gosh, that's convoluted. Well, hey, look, our phone, can have push notifications and an actual timeline calendar where where everything is at all times. And it's possible. I mean, even the government, the post service, I get an email with what mail is going to be coming. So, if they can do it, sure as heck we can do it.
No, and it seems so far, at least for a lot of the patients, they seem to enjoy it this way a lot more. Kind of what they used to have to do was sometimes travel 2 hours to see their dermatologist. Maybe they have to wait 3 months out to see their dermatologist. Sometimes they would have to go to the pharmacy that was 45 minutes away. Maybe they didn't have it in stock. So it's increasing access for a lot of folks, which I think is great.
It's the nature of healthcare nowadays where, very often insurance companies are looking to avoid providing care. And I'll mention this. This is not the doctor's or the doctor's office's fault. They are working tirelessly to try to overcome these obstacles that are created by insurance companies or the iPledge system. The doctors are doing everything they can to make the experience as good as possible for patients. But again, we're losing because the government and insurance companies are just bigger. And their goals are a little bit different. Their goals are not there to always help the patient. And meanwhile, the doctors here, we actually don't get paid to do any of that stuff. So it's extra work that somehow we have to figure out, the time to do it and how we pay other people to help us do it. It's so difficult.
Yeah, for sure. Now I'd love to pivot to kind of helping the audience too, for those who are on Accutane. As told by the medical director, are there some key tips that you would give somebody who is going through Accutane treatment via telemedicine through Clear Health at this very moment?
Okay, so hey, you're about to start Accutane. Buy some stock in Vaseline or some other sort of greasy ointment. There's a number that you can do. Aquaphor, Cetaphil has a great healing ointment. So does CeraVe. There's a number of great greasy ointments that you're going to need for your lips because everything gets dry, and that is probably that's one of the symptoms or the signs that we utilize to titrate up and down the amount of Accutane that you're actually on. So it has to be tolerable. Beyond that, you need a good skincare line. This is time to really pay attention to what you're doing. The good thing about Accutane, though, is that your skincare really kind of settles down to the most simple and basic necessities. These products are a gentle cleanser and a nice moisturizer. Now, Accutane also makes you a bit more sensitive to the sun. And don't give me that, I'm working in an office, I don't ever see the sun. You better believe that your backside is a lot more pale than, the top side of your arm. So, even walking to and from the subway, God, it feels so good to even say that. Living in Dallas, I have to say, walking to and from your truck, in the parking lot. But here, in New York, you're walking to and from the subway. Even there, you're getting a whole lot of sun. And so, as every good dermatologist will tell you, you got to wear your sunscreen. SPF 30 or greater, have it mixed in with your moisturizer, and you're good to go.
It also makes you ageless.
Okay, now we're talking about the age properties. Yeah. It's, again, come visit me in Dallas. All these people that have gotten years of sun, and you can see the leather skin that they have, and that will tell you, okay, I need to do something to prevent that. And, Accutane also has some, cosmetic benefits as well. And, of course, topically, you've got retinoids, which is, the topical version of Isotretinoin, Accutane. And that, of course, helps with skin turnover, wrinkles, overall tone, texture. Everyone, should be on a retinoid. That's like the cornerstone of skincare.
Mm-hmm. So what would you say to those? We get a lot of kind of patients who kind of call into support and they say, well, can I drink alcohol when I'm on it? They're in college, it's time to be free.
Of course. Well, so, again, not medical advice. I'm sure there's going to be some attorney that puts a waiver underneath this, or I guess it's a podcast. So, vocal waiver, not providing medical direction here, but as a doctor, I'll tell you, no, of course not. You should not be drinking when you're on Accutane. It goes through the liver, and it's too many hits on your liver. So that's my advice is no, you should not be drinking when you're on Accutane. Now, getting to your question of like, well, okay, but like, we're still going to. All right, well, so that's sort of a different approach. And yes, I have a lot of patients that will say, well, yeah, okay, doc, but, I got this party this weekend, and so I'm going to drink. Okay, so if that's the situation, then I want you to stop drinking that day before. So oftentimes I'll say, well, if you stopped your Accutane pill for the weekend, Friday, Saturday, Sunday, and then took it, the next day, I think that is a more safer way to handle that sort of situation. Again, I'm not encouraging it, I'm not condoning it, but again, your liver can only handle so much. So, when you take Accutane, it's impacting your liver. When you're drinking a lot of alcohol, you're also impacting your liver. That's one way to help modify it. But just be smart about it, and we also check labs to make sure, your liver is okay. And if that's something that, you're particularly concerned about, then yeah, your doctor can pay closer attention to it for sure.
So do you ever recommend maybe some other supplements or other things that they should take while they're on the treatment to kind of help mitigate those side effects?
Healthy diet, exercise, lots of water. Fish oil has been shown to help. It's not something I recommend for every patient, but a lot of people have utilized fish oil. Also, it helps with the just overall dryness of the skin as well. And so, again, I'd say it's worth giving it a try.
Yeah, it seems like with isotretinoin or Accutane, the side effects seems to be one of the biggest topics that come up. And so I want to talk now about last year coming out with this microdose protocol or Hollywood dosing. What is Hollywood dosing? What is the microdose?
Well, so it's we're as dermatologists we're giving away often our best secrets. It's not a secret though. This is something that we've done for where it came from. Hollywood dosing, LA dosing. People that just are going to be on camera very often and they can't have an off day. Now, of course, I'll always, specify even, Hollywood stars will have an off day. They'll have a pimple. I've had them in the office for a injection of some steroid into their pimple, so it definitely still happens. But if there's a way to decrease that, well, let's talk about it. And that's where you're taking Accutane in a lower dose form. Again, this is off-label, but you can take it in a lower dose over a longer period of time where you're not actually taking it every day. And that varies from a very low dose, maybe 3 times a week, to how we do it, where it's a moderate dose that you take twice a week. And you do that, it just kind of cures all that ails you. Keeps as many of those pimples, those blemishes, the acne, anything from what would otherwise normally form. It keeps it away. And the reality is when you do a treatment of Accutane, what I tell all my patients is say, hey, look, we're going to do this treatment, and actually about half of the patients could use another round of Accutane. And we're talking, full dose, full amount based off their weight. But more than half of those patients don't go forward with it because they're so happy with the overall results. And they're okay with doing maybe just a topical. But, one of the other options then thereafter is to do just a smaller dose of Accutane over a longer period of time. And it's worked well for all the movie stars. And if it's good enough for them, then it's good enough for the rest of the world too.
Yeah, for sure. It's also super interesting that if you kind of look around the other parts of the world, whether it's in Asia, South America, parts of Europe, the microdose or the low dose is actually the standard form of care versus kind of what we do in the US, where we kind of do the high dose for 6 or 7 months.
That's a very good point. And I'm fortunate I get to travel all over the world and learn about various healthcare systems and how dermatologists practice in different countries. And you're right. I mean, this is a treatment that is much more widely used in other countries. Why is it not as widely used here? Well, it's just a little bit more difficult. We have this iPledge system. And, as you just mentioned your whole story of not just having to go through so many dermatologists to get to the treatment, but then even the actual journey, the actual experience of the treatment with Accutane is not always easy. Those monthly doctor visits, going through the iPod system, if you're a female, it's 10 times harder and more difficult. It's a system that was built against us here.
Made just a little bit easier with Clear Health now.
Not just a little bit easier.
A lot easier.
This is efficient. And the thing is it's not, the goal was never to just, hey, let's make this easy for people. Because, there's a lot of, doc in a boxes, or just online, nurse practitioners that are just prescribing anything and everything. We're not drug dealers here. This isn't the patient just gets to come in and choose whatever they want and pick it off the shelf and buy it. No, we wanted to actually improve the access to this higher level of care. And I think we've done an exceptional job with that.
One of the reasons the microdose, I think the access has been an issue too, goes back to the insurance piece discussion where because the traditional dosing in the US is that 6 months, a lot of times what we see is the insurance company won't cover the dosage beyond 6 months.
It's a huge pain. And for all my other dermatologist friends out there, this is something we're thinking about and talking about. How can we help you with your administrative burden? Because right now, if you try to do that dosing with one of your patients in your office, it's not very easy, as Michael was saying. Oftentimes, what they're doing is we're prescribing it for a whole month's worth and then telling the patient, well, that's what the prescription says, but here's how I really want you to take it. And then you still have to start storing up pills. Or they travel to India, or they order it from there, or they go to Canada. Of course, who knows what people are doing now with all the tariffs that are going on. So I can't even imagine. But again, that's not the best safest care. It just isn't. So just if there's a way that we can figure out how to help the administrative burden just for our dermatology colleagues, we're looking to do that and partner with them, really just to, the answer has always been, if you put the patient first and you do what's best for the patient, everything else good follows. And that's what we're doing.
One thing that's super interesting that we found kind of starting Clear Health is a lot of the folks who come on to are very active. I noticed for myself when I started breaking out the worst was when I actually started lifting more and exercising and kind of getting more into fitness. And this actually became a huge topic where last year we actually went to a bodybuilding competition to ask bodybuilders, do they think there was this connection between working out, fitness, and acne? So I'd love to get your take on that too. Do you see this correlation of fitness, acne? How do those topics relate?
Of course. Let no good deed go unpunished. We sometimes forget that, hey, look, we're human beings, we're animals. So we sweat, we get cysts, we have pimples and all that. And so, and I have a lot of professional sports athletes who deal with a variety of different issues, fungal infections, and of course, acne. Now, again, we're talking about acne different from when you talk about bodybuilders. Sometimes they're using performance-enhancing drugs, they're using testosterone. That in and of itself produces a whole ton of acne, and that's not really, the scope of what we're discussing here, because that's a whole other hormonal imbalance that, they're causing. But just simply, us, the weekend warriors, that are working out and sweating and, developing more acne. Absolutely. You're increasing the sweat, you're increasing the oil. And acne, of course, it's multifactorial, but that, of course, does increase your risk of having more acne. Now, what can you do about it? I'll tell you what that dermatologist that I first, when I was a teenager, told me. Well, you just have to shower within 15 minutes of every time you sweat. Yeah, well, he wasn't wrong, but how does that work in anyone's daily life? Mm-hmm. Well, I'll tell you, there are certain things you can do. I love this idea of just having, I call them dude wipes because I'm a dude, but it's, whether it's a makeup wipe or what have you, it's a cleansing cloth that you just keep around, either in your car door or let's say you have it in your gym bag. And after you're sweating, or, even if you're a teenager in school and, after recess, you just take one of those out and you wipe yourself down. And those little things really make a big difference. When it comes to truncal acne, acne on your back and chest, backne as everyone calls it, there are good things to do there. Cleansers, things with like benzoyl peroxide and salicylic acid, have that in your shower. So every time you're showering, you're really scrubbing that in and let it soak in. I tell people, sing the happy birthday song. So you got 20 seconds of it kind of like soaking in and really letting those ingredients do what they need to do. Exfoliate once in a while, maybe with like a little glycolic wash. And if you're still struggling, then hey, come on to Clear Health or see your board certified dermatologist. We have other prescription options, as well as, of course, Accutane works really well. It's a large surface area, and it's not easy to apply a bunch of creams to your entire back. And we all know no teenager or 20-year-old wants to have their mom put a bunch of medicine on their back every night. And so in this case, a more systemic problem needs a systemic treatment, and Accutane's that answer.
I mean, we talked about Accutane a lot, sort of these other topical treatments. Are there any new treatments in the pipeline that you're seeing that you're particularly excited about, whether it's for acne or some other conditions?
Well, so when it comes to just other conditions, I'd say what's most exciting is going on is the inflammatory disease state. We're talking atopic dermatitis and psoriasis. We have these biologic medicines, which right now are injectable medicines that go around and they basically bind with these cytokines. What are cytokines? They're messengers. They're messengers in our body to say, hey, increase the immune system or decrease the immune system in a variety of different ways. And these are almost cures, not cures because you have to keep utilizing the injection, but they basically get rid of this disease. Now, what's cool about it is they're developed small molecules for this, particularly in atopic dermatitis, and they're also developing peptides. So taking those injectables and turning them into pills that actually work just as good. It's very cool, very exciting. On the acne side, I think one of the latest additions has been a new medication, clascoterone, which is essentially works through a hormonal pathway. A lot of women are dealing with hormonal acne, and right now the go-to has been a pill, spironolactone, which works well. But hey, maybe we can just apply it to the actual area as a topical form. And so I think that's become a new pillar when it comes to the treatment of acne. There's also a new antibiotic as well that I know you're thinking, well, what's new about antibiotics? Well, right now we use broad spectrum antibiotics that treat a whole bunch of different bacteria. There's a newer, more acne focused tetracycline called sarecycline that, because it's so narrow, it's not going to really kill any other bacteria except for the C. acnes that we know is a really big proponent or a big cause of our acne. And so you don't have to worry about bacterial resistance. And it's also easy because it's once daily and it's not upsetting to your stomach. So there's a lot of value there.
Sounds like it's possible alternatives for those who don't want to go through the Accutane process, the iPledge process.
Absolutely. And that's always been our goal here. Yes, Accutane was really, that was the experience that started this, your experience with that. But again, we want to have the best treatments for each individual patient. It's that precision medicine. And so no, this is not just go on the website, click a couple buttons, and you get your Accutane shipped to you. It's actually discovering what's really the cause here of your acne. And then here, we have a variety of different treatment options, and let's figure out what makes sense for you. Also understanding that, hey, you're allowed to change your mind. If your experience is, wow, this topical isn't working or this pill isn't working, and now we want to move to a different sort of therapy or go reverse on it, that's what we're able to do here.
With that in mind, what are some areas you're excited to see Clear Health go into beyond acne kind of as we go along?
Well, again, it's really identifying a variety of different skin issues that our patients have, and then making sure that we provide the full breadth of treatment options. Your experience of going through 5 dermatologists to get to Accutane, again, is extremely frustrating. And when I talk to my patients about any disease state, but acne in particular, I list out all the treatments. Because even if I don't think maybe they're appropriate for Accutane, I know that they're going to go online and they're going to search acne, and they're going to find things. And then when they see, wow, why didn't my doctor talk to me about these other options? Well, that's, again, it's not really, full disclosure there. So I like the idea of going into these different disease states and making sure we can provide all the treatments. What are those? Well, we have rosacea, which is a neighboring disease state as well. Excessive sweating, there's options to help that. So we want to make sure that we do everything here at Clear Health correctly. So again, it's making sure that we're utilizing our technology not just to send out as many prescriptions as possible, but it's actually really to help these patients identify and diagnose them correctly. Right now on Clear Health, you're seeing a board certified dermatologist. That's pretty awesome. That's very difficult to do even across the country. Oftentimes you're waiting months, and many times you're seeing a physician assistant or nurse practitioner. And again, there's no issue with that. They're very highly trained too. But a board certified dermatologist, is, all those years of training, very important, for some of the more complex diseases to be able to be seen. And that's not easy across the country right now.
Any closing tips you have for the audience for anybody who's struggling with acne right now, kind of going through it? What would you tell them?
Well, closing tips, I thought you were going to stop there, and I was going to say, well, like every dermatologist, always wear sunscreen. And that goes along with acne. But no, the closing tips with regarding acne and Accutane is, you have to be a good advocate for yourself. Now, that doesn't mean that, hey, look, you just get to, go in and pick off whatever you want off the shelf and you're prescribing, your own treatments. You didn't go to med school for that. You're not allowed to do that, right? And there's good safety reasons for why that is the system. But you can and should be an advocate for yourself and not give up, and understand, that if you're not getting your message across to, the clinician, whether it be, on us, telemedicine, teledermatology, or your dermatologist in your office, then it's okay to get a second opinion. It's okay, respectfully to say, hey, look, I need to advocate for myself to get the treatments that, I think that, may benefit me the best or the most.
Consumerization of healthcare.
Yes. Well, and again, there's been a lot of good, but there's also been some issues with that. Yep. Because, it's the almighty dollar. And again, I would say, let all those other industries, search for that, strive for that dollar. Here, we're going to continue to do what's absolutely best for the patient. We keep our side of the street clean and clear. Let other people elsewhere do what they want to do. We're going to do the right thing, and it's going to lead to all the good things in life.
Sounds great. Aaron, always a pleasure.
Good seeing you, Michael.